Okay, good morning, everybody. My name's Anthony Singh. I am lead pharmacist for North West Leicestershire GP Federation. I'll explain what that means in a moment. I'm also a menopause specialist. Sorry I can't be there with you today. The state of the world means it's a bit difficult to get home at the moment. But I'm really grateful for Nelly inviting me, and I hope the answers I give to your questions that you've sent in will help fill that void of me not being there with you today. Hit me.
Okay, so we've got a few questions for you, Anthony. What advice would you give pharmacy students who have an innovative idea, such as starting a specialised clinic, but are hesitant to pursue it? And what moment made you feel that courage?
Okay, there's never been such a great time to be a pharmacist, especially in primary care. 5 years ago, 6 years ago, there was next to no pharmacist within GP surgeries, and that's what we mean when we mean primary care. Whereas now there's 8,000 pharmacists within primary care, and I'm one of many that have these weird individual passions that they want to help improve. And pharmacists don't really have a ceiling anymore. If you have an idea or a particular area of practice that you want to build on, my first piece of advice to everyone in that situation is make sure that your knowledge base within that area is really good. Go to every conference you can, read every clinical paper you can, spend time with people who are experts within that area, networking, reading their papers, and then if you do choose to work in primary care, it's a lot easier to build on your own entrepreneurial ideas. So to have a private clinic, if you so wish, or a NHS clinic like mine within one GP surgery, and then you'll be able to expand it across a whole range of GP surgeries, and then perhaps across the country.
How did you go about setting that clinic up initially?
Okay, so originally I identified a need. I saw that none of my GP colleagues really knew confidently how to manage patients when switching someone from one HRT to another HRT. So the first thing I did is I identified a need. Davina McCall did a TV program which sent HRT prescribing through the roof, and as a result I just identified that there was a huge gap within menopause or women's health, and I asked my clinical directors if I could go on a training course, which they paid for. Not always the case, but I was very lucky that my clinical directors paid for it, and I went on that course, got a little bit more knowledge, and then asked if I could do a little small clinic, no more than about 4 patients a week, and now I run 3 clinics across the whole of Leicester, Leicestershire and Rutland, and I get to set up clinics across the country. So start really small, focus on evaluating your clinic after patients are booked in. I always look at efficiencies within a clinic, so how do you automate it? We send a lot of AI videos out to patients, so use what you have, like your youth and your ability to understand the way that digital healthcare works is something that our current clinicians perhaps don't have as well as you. Use what you've got to get what you need, quite simply.
Why did you choose menopause?
So I have a quite difficult personal history. People in my family, I come from a Sikh Punjabi background where menopause isn't really talked about, and women just kind of suffer in silence, and that's a topic I wanted to solve from a very, very young age. And I've done that now, to be fair. And I think they're always the best projects. I run loads of projects across my federation, but the best project will always be the menopause project because I have a personal drive to it based on my family history, or my mum's history to be specific. So my advice to everyone and you guys is when you're picking a topic or something that you want to specialize in, pick something that means something to you. Don't be one of these generic people that pick asthma, hypertension or diabetes. Pick something that really is valuable to you. May that be atrial fibrillation, migraines. Weight loss is incredibly topical at the moment. Anything that it's small and niche. Trust me, I'm a 35-year-old Asian male that wanted to specialize in menopause. It was weird, and still is in some days. So pick something that means something to you and build your knowledge base around that.
So can you just tell us a little bit about your role and what it entails?
Okay, so I lead a team of about 40 pharmacists across 12 GP practices, and when GP surgeries join together, that's called a PCN, a primary care network. Some people refer to it as a federation. There's a small nuance there, but we do use them terms interchangeably, mistakenly. So I manage a team of 40 pharmacists across 12 practices. I have clinical pharmacists or pharmacists that work at individual practices are part of that 40. Then I have senior pharmacists that manage some of those, and then I have me and my colleague who are lead pharmacists for the whole of the 12 GP surgeries. And my role is really cool, where I get to focus on projects, so things like the menopause clinic, our ADHD clinic, migraine clinic, vaccine, MSD, HPV vaccine that we're doing with a pharma company. So my job quite simply is to manage all the projects that we do between us and pharma companies, us and hospitals, us and tertiary care units, and research, as well as managing my team of 40. From a pay structure point of view, clinical pharmacists, when they walk into general practice, are paid around about, I'd say about £40,000 to £45,000 basic, and regardless almost if they've done their IP or not IP, because pretty much all pharmacists now have done their IP. Then my senior pharmacists were paid about £55,000, and their responsibilities are slightly different. Their responsibilities are to do the one-to-ones, the appraisals, sick days, holidays, and manage all that for my staff. And then my lead pharmacists are paid about £75,000 basic salary. In addition to that, within general practice, you have the ability to work extra, do something called enhanced access. Not always the case at every GP practice, but it does exist. And we pay about £58 an hour for a pharmacist with an IP to do enhanced access. So that's hours outside of the normal 9 to 5, perhaps on a Saturday or an evening, perhaps even on a Sunday in the foreseeable future. Yeah.
So would you say there's been a defining moment in your career so far, and what has that been?
Defining moment in my career? Yeah, there's lots. I'm very lucky. I've won 2 of the 3 awards that I wanted. So the Chief Pharmaceutical Officers Award, I won that a few years ago, and the British Menopause Society Award, which were always the 2 biggest awards that I wanted. There's one more called the HSJ Award, which still eludes me, but I will have that one day, I'm sure of it. So yeah, I'd say they were the defining moments that really put me on the map nationally, and allowed me to make the impact that I get to make across the country, which is pretty cool. Yeah.
How do you ensure women feel heard and supported when discussing menopause symptoms that are often under-recognised?
It's a fair question. So I think simply, it's not rocket science, that's the thing. Menopause consultations aren't hard. It's just, half the battle is just listening and having the ability to listen to someone's symptoms and then offer treatment. Too often within primary care, not even primary care, healthcare as a whole, we're always trying to just give a solution. Sometimes just sitting there and listening to someone's problems is half the problem. So yeah, listening to them within that consultation, giving every patient a golden minute, and then offering them options rather than you making the decision of what HRT contraception to prescribe for them, giving them the option to make an informed decision rather than that decision being made solely by the clinician.
Looking back at your career, what would your younger self be most surprised or proud to see you accomplish today?
I think the fact that I am the country's leading pharmacist on menopause care is really surprising, but I think that's surprising now rather than, it will still be surprising as it is as much now as it will be in 30 years time. It is strange for I was 30 when I started this 30-year-old Asian male that opened a menopause clinic, and everything I do is for free, every consultation, no one pays anything. Most pharmacists that gain the accreditation that I have, and there's not many of us, often open private clinics, and that goes against everything I personally believe in. Yeah, so I think that's the most surprising thing that little old Anthony would look at.
There are obviously ups and downs in every job, and so what part of your work makes you look forward to coming in each day and not so much?
There are ups and downs in every job. I've done most sectors within pharmacy now, and I think general practice, I know I'm going to be biased, and I know there's colleagues around you, or perhaps sat on the stage today, that work in other aspects of pharmacy, but I think general practice or primary care is the best sector of pharmacy. It's so easy. Like, I work from home usually. Sometimes I'll go into my surgeries, and obviously that's flexible and dependent on individual GP surgeries, but there's so much more flexibility. I've worked in hospital and my feet used to ache, and I used to do on-calls and nights and lates. Now I'm finished at 4:59 every single day. You can be more flexible if you have children and other commitments within life. There's no responsible pharmacist legislation, so you can nip out to the dentist if you need to. The pay's pretty good. If you work really hard and build yourself up in specialism, pharma companies, not just pharma companies, other people will hire you to do other stuff and pay for you to do advisory boards and fly you all over the world to do conferences and talks. So yes, there's many attractions to working in primary care.